All right, folks, we're taking your calls on the Conrad Murray case, the death of Michael Jackson, and whether or not you think he should go to trial in this case. Give us a call, 1-877-JUROR-13. We'll get to those calls in a minute. But right now, we want to get more into Murray's use of propofol. Anesthesiologist Dr. Barry Friedberg is the author of Getting Over, Going Under, and he joins us from Los Angeles. Doctor, thanks so much for joining us.
Good morning, and thank you for having me.
Let's start with propofol. When you hear the words propofol, what is the appropriate use of it, and who should be administering it, where, and under what circumstances?
Well, the use of propofol is widespread, even among gastroenterologists. The secret to keeping propofol safely, and when I tell patients that I'm going to give them propofol and they say, wasn't that the drug that killed Michael Jackson? I say yes. But hundreds of millions of people have had propofol safely precisely because someone was watching them and somebody was monitoring them. It's not the drug, it's the manner in which it's being given.
All right, let's talk about watching and monitoring. So you give someone propofol for, let's say, whatever reason. What do you, as a doctor, what is the standard practice? What should you be doing?
Well, first and foremost, you want to be watching the patient breathing, watching their airway. And you, of course, want to be using a device that you can see here called a pulse oximeter. I'm not sure that the sensor is going to pick up right now. But the key thing about the sensor is that, as you can hear, it makes a sound. And when the oxygen level goes down...
Uh-oh, doctor, do we have an emergency out there?
No, it's just tracking me. But when the oxygen level goes down, the tone goes down. It goes from beep, 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 long before the patient has a cardiac arrest. This is your opportunity as an anesthesiologist or anybody else giving the propofol to lift the patient's chin and open the airway so that they can continue to breathe. If they've got too much propofol and they can't breathe, you want to put an ambu bag and breathe for them.
So, I mean, the device that you have there, if you could show it to us one more time, doctor, is this routine? Is this something that any doctor should know?
Not only is it routine, it was deemed a standard of care in 1990. Any television show you see with a patient in a hospital, they've got this little sensor on their fingertip. Even Tony Soprano had it when he was in the ICU. There's no question that you don't give propofol without a pulse oximeter on it, and Dr. Murray clearly knew there was such a thing because he had one in the house.
All right, so if you have that on, is there any way for that thing to malfunction? Like, let's say, for instance, the story of the defense is, we were using this machine, but, we didn't hear it. Or it didn't function properly. I mean, how do you know if the machine's working or not working, and what are you looking out for?
Well, as you can see here, there's a waveform on the screen, and the machine picks up the patient's blood pressure waveform, and so you know that you're getting information from the patient. Sorry. And you hear the tone, and you also see the infrared light in the sensor. I don't know if the camera can pick that up or not. But these are very basic sort of things that you do to make sure that your patient is getting enough oxygen.
And here's the question, doctor. Here's the big question, doctor. Is there ever a reason to leave the room? Like, let's say he's giving him propofol to sedate him so he can sleep, so he can get some rest. Is there ever a reason to leave a room? And if you do leave a room, what should you do?
Well, interesting you should ask that, because in the office-based setting where I give anesthesia, it's very much like giving anesthesia in any other remote setting. Sometimes you have to go to the bathroom, but you set the stage so that you can listen to the tone of the pulse oximeter. Or in the worst case scenario, you get one of those baby monitors that you actually have a visual on Michael Jackson and seeing him breathe, as well as listening to the sound of the sensor. So it's not the issue that you can't possibly leave the room. If you do, you have to make provision to be sure that you can continue to have eyes on the patient.
All right, doctor, I have one final question for you. If, in fact, the prosecutor's allegations are true here, that he administered the propofol, and Michael Jackson died as a result of all that, and he didn't take these precautions, do you believe Dr. Conrad Murray should be held criminally responsible?
Absolutely. There's no question. And Conrad Murray, in his own public statement, said he gave the propofol, and he also said he wasn't in the room after he gave the propofol. It's the most egregious of all possible anesthesia sins, is called patient abandonment. And that's precisely what Conrad Murray did. And in the 11 minutes of the phone call that he was out of the room, Jackson had been dead for 6 minutes. You only have 3 to 5 minutes, in which case all of the oxygen in your lungs gets used up. And as the famous physician said, the lack of oxygen not only stops the machine, it wrecks the machinery. So everything he did after he came into the room, Conrad Murray that is, was all for show. Michael Jackson was dead by the time he came back in the room. There's no question in my mind.
Dr. Barry Friedberg, thanks so much for joining us. Really appreciate it.
You're welcome.